Hello everyone, welcome to our lecture on pharmacology for nursing students. Today we'll cover several key topics essential for your understanding and practice in nursing. Let's get started. Here is an overview of what we will be discussing today. We'll start with gastrointestinal pharmacology, move on to haematinics and anemia, and then cover laxative, antispasmodics, and antidiarrheal agents. We'll wrap up with a conclusion. Thank you. First, we will dive into gastrointestinal pharmacology. We will look at peptic ulcer disease, its pathophysiology, clinical manifestations, and medical management. Finally, we'll go through the classes of drugs used to treat this condition. So, peptic ulcer disease or PUD is a condition where there is a break in the lining of the stomach, lower esophagus, or upper part of the small intestine. This occurs mainly due to an infection caused by Helicobacter pylori bacteria. Understanding PUD is crucial as it forms the basis for discussing various gastrointestinal drugs. Let's understand the pathophysiology of PUD. The body has defensive factors like mucus, bicarbonate, blood flow, and prostaglandins that protect the gut lining. However, aggressive factors such as Helicobacter pylori, NSAIDs, gastric acid, pepsin, and smoking can overwhelm these defenses, leading to ulcer formation. Patients with PUD typically experience a dull, gnawing, or burning pain in the mid-epigastrium or back. They may also report heartburn, vomiting, and changes in bowel habits like constipation or diarrhea. In severe cases, there may be signs of bleeding such as starry stool, known as melena. The management of PUD involves a combination of pharmacologic therapy, lifestyle modification, and dietary changes. Pharmacologic therapy includes antibiotics and antisecretory agents. Lifestyle changes involve stress reduction, rest, and smoking cessation. Dietary modifications are important too, like avoiding extreme temperatures in food and beverages, and steering clear of alcohol and caffeinated drinks. The drugs used to treat PUD can be classified into several categories. These include antibiotics to eradicate H. pylori, antisecretory agents like proton pump inhibitors and histamine 2 receptor antagonists, mucosal protectants, and antacids. Each class plays a specific role in managing and treating PUD. Antibiotics such as amoxicillin, clarithromycin, metronidazole, and tetracycline are used to eradicate H. pylori infection, which is a primary cause of PUD. These antibiotics work by targeting and killing the bacteria. Common side effects include nausea, diarrhea, and changes in taste. Antisecretory agents are divided into two main categories. Histamine type 2 receptor antagonists like cimetidine and ranitidine work by blocking histamine type 2 receptors or H2 receptors, thus suppressing acid secretion. Proton pump inhibitors, on the other hand, like omeprazole and esomeprazole, inhibit the proton potassium ATPase enzyme, which is essential for acid production. These drugs are effective but may cause side effects such as headache, nausea, and diarrhea. Mucosal protectants such as sucralfate form a barrier over the ulcer crater, protecting it from further damage. They can cause constipation, Antacids work by neutralizing stomach acid, providing quick relief from pain. The specific side effects of antacid depend on the formulation used. Next, let's talk about haematinics and anemia. Haematinics are medications or nutrients that are required for the formation of blood cells and hemoglobin. Anemia is a condition characterized by a lack of healthy red blood cells or hemoglobin, which results in inadequate oxygen delivery to the body's tissues. Types of anemia. Anemia can be classified based on the cause and the size of red blood cells. The main types include iron deficiency anemia caused by a lack of iron, megaloblastic anemia due to deficiency of vitamin B12 or folic acid, and pernicious anemia, a specific type of megaloblastic anemia caused by the inability to absorb vitamin B12, often due to a lack of intrinsic factor. So, major haematinics include ferrous sulfate, used to treat iron deficiency anemia by replenishing iron stores. There is also hydroxycobalamin or vitamin B12, used for pernicious anemia and other vitamin B12 deficiencies. And then there is folic acid, which is essential for DNA synthesis and repair, and is used to treat megaloblastic anemia due to folate deficiency. These agents promote red blood cell production by providing essential nutrients. Side effects can include gastrointestinal disturbances and allergic reactions. So listen, let's now discuss laxatives, antispasmodics, and antidiarrheal agents. These are all part of GIT pharmacology. So laxatives can be classified into bulk forming laxatives like psyllium and methylcellulose, which increase stool bulk. There's also stimulant laxatives like bisacodyl and senna, which stimulate bowel movements by irritating the intestinal wall, and osmotic laxatives like lactulose and polyethylene glycol, which draw water into the bowel to soften stools. Antispasmodics such as hyoscine and dicyclomine relieve intestinal spasms and cramps by relaxing smooth muscles. Antidiarrheal agents like loperamide and bismuth subsalicylate slow down gut movements and reduce fluid secretion in the intestines. To summarize, understanding the pharmacology of gastrointestinal and hematinic drugs is crucial for effective nursing practice. Proper management of conditions like PUD, anemia, and gastrointestinal disorders significantly improves patient outcome. Your knowledge of drug actions, side effects, and patient education will be essential in your nursing practice. Thank you for your attention. If you have any questions or need further clarification, feel free to contact me. I am here to help you succeed in your studies and future nursing practice.